What's going on, guys? Dr. Andrew Fix back here for another episode on the code. And I'm super excited about this interview that we have lined up this morning. I'm back in the office at Tri Vida Functional Medicine, talking to Corey Feldman, one of the owners here and the primary provider here at Tri Vida. And those of you that listen to this show may have remembered he was actually on this podcast very early on. We had one of the first handful of interviews was right here in this office. And Corey, thanks again for joining me, man.
My pleasure. Thanks for having me. I appreciate you.
Absolutely. Absolutely. Well, this is going to be fun. We're going to get into, sort of the topic of heart health, talk about athletics a little bit on this episode. But what I would love for you to do, just in case somebody hasn't had an opportunity to go back and listen to that other one, where we talked a lot about Tri Vida and about functional medicine, would you do us a favor and just sort of like reintroduce yourself, tell us a little bit about you and your background, and let us know who Corey is.
Yeah, absolutely. Well, I started my medical journey as an athletic trainer, and maybe for those of you who don't know who an athletic trainer is, it's that person who runs out on the field when someone's hurt. That's just the tip of the iceberg as to what they do. They focus on rehabilitation and sports performance and nutrition and all these different things. So that's where I got my introduction to medicine in high school, college, and even at the professional level, working with the Denver Broncos and the Colorado Crush, an arena football team when they were around. Wanted to expand my horizons, so I went to PA school, physician assistant, now called a physician associate. So, name change there. And I've been doing that ever since. Worked in family practice, ER, urgent care. Was really finding that I wasn't really helping people the way I wanted to help people. I was just really band-aiding problems and literally watching people die of preventable diseases around me, day in and day out. And so found functional medicine very much by accident and have been practicing it ever since. And that was 11 years ago.
Awesome.
Yeah.
Awesome. No, I did not know that the sort of title just changed there from physician assistant to associate. When did that officially take place?
I think it's still officially happening.
Yeah, in the works.
In the works, but only just like 2 or 3 months ago.
Got it.
Yeah.
Awesome. Well, I like it.
Yeah.
I like it. So you said you started out your journey as a athletic trainer, found functional medicine. When was it that, what year was it that you sort of made that transition into the functional medicine realm?
Space? Probably, gosh, it was 10 years ago. So now 2013, 2014.
Wow. It's hard to believe that 10 years has passed probably since you started that. And I know you spent some time working in the sports medicine side of things as well. But I know recently here, you guys have some exciting things happening here at Tri Vida, where you're getting more into like the athletic side of things. I know you've spent a lot of time really helping people uncover the root cause of, issues that they've been dealing with, and maybe people who have bounced around the medical system and been unable to find solutions to their problems. You help them uncover the stones to figure out what's going on. But now you're sort of moving more into the performance and sort of the optimization side of things. So sort of talk us through that transition just a little bit. Not that you're stopping doing what you've been doing, but just going a slightly different angle to help more people.
When I worked in athletics, I loved working with athletes because athletes in general are very driven, and they want to do whatever is necessary to be optimal performers. And they don't require a lot of hand holding or convincing as to what to do. So that's something I always loved about athletes is I would tell them to do something and they would do it, and then they had good results because of it. And so I really love that population, and I want to work with them again. And being an athlete myself, I'm always looking for that next edge and that next something. So everything I'm recommending, I've either done or am doing on myself.
Yeah.
So things we're working on constantly with everyone, but specifically with athletes, is nutrition, sleep, exercise and sports performance, heart health is another huge thing. I'm blanking on the guy's name, unfortunately, but the Buffalo Bill who died on the field. I apologize.
Yeah, Damar Hamlin.
Hamlin. I apologize for his name. No, look, I don't know the whole story, but that was probably very much preventable if he had something called an echocardiogram done to see that he had an enlarged heart and to see that there was a problem. So we're even doing things like that just to make sure that these types of things don't happen to any other athlete.
Yeah.
So looking at athletics from a whole perspective, preventative, but also performance based.
Yeah. Yeah, totally. Now, fill me in, or not, like I know a little bit about this, but maybe not the people listening to this show. What's your athletic background like? I know you've been involved in mixed martial arts and yeah.
Yeah. I mean, so I grew up kind of I call myself a fat kid. You know, I wasn't the most athletic kid growing up, but came into my own around 13, 14 years old, but really never was into into team sports, more individualized sports, martial arts, starting with Taekwondo, then moving to Brazilian Jiu-Jitsu, Kempo Karate, things like that. I also ran cross country in high school, but mainly, and then I lifted a lot of weights and any excuse to be athletic, I will be athletic.
Yeah.
But yeah, mainly martial arts is my form of athleticism.
Yeah. And I spent so much time in, growing up in like the team sport side of things. And then more as I got into high school, then I started to wrestle. That was kind of more my, okay, now this is an individualized, it's a team, but it's individual, right? There's one person from each team on the mat at a time, and very different, right? Two very different sort of mediums there. And then so many people find the gym as like their competition realm. Now, when was it like let's sort of start to dive down this heart health side of things. You mentioned, of course, sleep is very important. Nutrition is very important, not just for athletes, but for everybody. But, heart health is something that, for maybe the average person, like we all know, okay, we should try to sleep 8 hours a day. We should eat, quote unquote, healthy, whatever, there's a lot of maybe definitions of that depending on who you ask. But what is it that makes you like particularly interested or curious about like the heart health side of things when it comes to athletes?
Right. Well, one of the big triggers for my interest in heart health was a friend of mine passing away from a heart attack at the age of 53, a very active, vibrant man, I would call him. I mean, he was a mentor of mine, died suddenly after jiu-jitsu class, driving home from jiu-jitsu class. Died of a heart attack at the age of 53. So that was kind of a spurring moment. Everyone was just shocked that this person, this happened to this person. So that was kind of a spurring moment for heart health for me.
Got it.
And then also with myself having genetically very high cholesterol, and this person I'm talking about who passed away, him and I had very similar mentalities, very similar lifestyles. So I saw myself being him if I didn't change something. So that was a really big spurring moment for me. And then, watching people like Damar Hamlin die on the field. I mean, that's not the first time that's ever happened. That happens over and over again. Or you hear the story of the guy who's 50 years old, perfect shape, dying on the treadmill.
Yeah.
Right. How does that happen? Right.
Yep.
So all these things were just accumulating in my brain, and I said to myself, I bet I could figure this out, and that we could fix this, and this doesn't have to be this way.
Yeah. And yeah, you've heard stories like that where like an extremely fit triathlete or something has heart complications, and from the surface view, you're like, I don't understand how this happens. This person exercises all the time. They're more fit than any of their peers. But yet something like this happens. Without asking like too broad of a question, generally, like, why is it that something like that happens, like in a person like that who otherwise appears very, very healthy?
The most common thread is genetics, I believe. It's just that they're born that way, and the big problem is no one looks at these people in depth heart-wise, because they do look a certain way and they can perform, and they're not 50 pounds overweight or a smoker or have high blood pressure or have diabetes. These are the people that get like fine-tooth comb looked at from a cholesterol and heart perspective, where people who are just kicking ass on in life and in exercise, either one, don't get looked at, or two, don't even think to go in to get looked at.
Yep.
Yeah, so that's I think that's the biggest reason stuff gets missed, and the biggest reason it happens in the first place is generally genetics.
Yeah, and I think I'm glad you mentioned that, like, don't even go in or think to go in, because I don't know, this might just be my perception. I feel like this happens a little bit more now, where maybe the average person doesn't go to their physician's office quite as regularly as like probably my parents' generation did, right? Where I remember when I was growing up, whether this was because you had to have it for sports in high school, but you had to have like an annual physical, and you had to like turn in like an AOK from the physician that you're able to play sports at school. But now I probably haven't had one of those in, man, I don't know how long. The last provider that I came in to see for a screening was you, about a year ago, or maybe just over a year ago, to kind of go through that panel and that assessment. But I haven't been to the quote unquote traditional physical therapy, the traditional physician office, for many years. And I've pretty much used, as my wife and I, Erin, have moved around, my quote primary care has basically just been urgent care when I feel like I have an issue. I have strep throat or whatever. I'm not quite sure why that is. Why it seems like maybe people aren't going in for their regular screenings as often, unless there's a problem.
Right. And I think it's a paradigm shift in people. I think the days of the family practice physician are coming. Again, I don't want to make that broad of a statement, but are kind of coming to a close, right? Our generation, 30s, 40s, 50-year-old people, a lot of them I find don't have a primary care physician, a person they go to all the time, which again is okay, but you need to be, personally, this is my opinion, you need to be getting checked in on every 3, 6, at the most 12 months, to make sure that, everything's looking good. And at this moment in time, blood work seems to be, the one of the better ways. But we could talk about, if we have the time, there's a million other ways to look into the body safely to see what's going on. But at least getting some blood work done every 3, 6, 12 months would benefit anybody.
Yeah. And so for someone listening to this show as like an actionable step that they might be able to take, no matter who their traditional family or primary care provider is the typical blood panel that you might get, right? If you fast in the morning, you go in for a lab test, you get your blood drawn, is what generally gets assessed in those tests going to be sufficient in order to potentially catch or clue the provider into some of these issues that we might get into talking about, right? The apparently fit person who underlying might have heart complications. Is that normal blood panel going to catch the things that it needs to catch in order to clue us into that?
You're a great cuer upper, man. I love it. Yeah. In my opinion, no.
Okay.
No, unfortunately. I have a lot of people coming in here and talking to me, and they bring in their blood work, and they're very happy with their blood work. Like, look at how much blood my doctor gave me, and I look at the blood work, and I want to caveat before I say this. I want to caveat by saying, I hope I'm okay with this language, is I am not a dick, and I am not a type of person who's going to tell you, well, your doctor's stupid and I'm smart, and they're dumb, and I'm the best, they're the worst. I'm never going to say that.
Yeah.
But the blood work I see people getting is very surface level, and it's basically, if that blood work is off, you have big problems.
So then stuff really off. Right. Yeah.
So your average person who's generally healthy gets that blood work done, it should be okay.
Pretty good.
It should be fine, right? It's not until you dig a lot deeper, and we can get into that if you want to, but my blood work is about 200 tests long.
Yeah, right.
And that's how you get to these underlying problems that may not be a problem yet. You may not be able to feel it yet, but it's coming. It's just a matter of time.
Well, so you just mentioned, you think it is a smart practice to every 3, 6, 12 at the most months get regular testing done so you can track where you're at. And as we know, what gets measured gets managed, right? If you don't check things, well, how would you know? So in the traditional, typical blood panel, what are the things that are commonly looked at in that? And then, as the second part to that question, what other things does that miss that we should be looking at? Like, I know you said you don't have to name off all 200 different tests, but like, what are the highlights, right? What are the things that gets looked at in the basic blood panel? And then what are the things that you additionally try to look for in a more thorough screening for somebody?
So your traditional blood panel, and again, it depends on your doctor, but generally your traditional blood panel includes something called a CBC, which looks at your white blood cells, red blood cells, platelets, all the pieces, parts, size, shape, production of that. Great test, but again, very surface level. Something called a CMP, or a comprehensive metabolic panel, looking at liver, kidney, electrolytes, bones, muscles. Again, a great test, but again, very surface level. Something called a TSH, which is not your thyroid, but your brain's connection to your thyroid. And maybe if you're lucky, a T4 and a T3, which is the actual production of the thyroid hormone. And, maybe a vitamin here and there, a vitamin D, a B12, maybe an iron, maybe a ferritin, which is the stored form of iron. But that's, and then if you're having a specific problem, maybe they'll add something else to it.
Yeah.
That's about it.
Okay.
That's about it.
Yeah.
And again, if you see problems in those tests, you've got much bigger problems.
Got it.
Right. And so then the second part of that question is then what should we test? We should test all those things. So don't get me wrong, all those things that I just mentioned should be tested consistently.
Yeah.
And all those things are part of my testing. But, we need to see, how is your gut gastrointestinal system working? How well are you digesting, absorbing foods? How well are you absorbing nutrients? So not just vitamin D, not just B12, but all your nutrients, zinc, selenium, copper, iodine, you name it. All these different things need to be assessed as well. Hormones, and not just thyroid, but there's 50 that we know of. I believe there's more. We just haven't discovered them yet, but there's 50 at least that we know of major hormones in the body. And hormones are the communicators, along with neurotransmitters. Hormones are the communicators of the body. And it blows my mind that no one's testing hormones. Or if they are testing hormones, they're testing one or two, which is unfortunately just looking through a pinhole of what you could be actually testing. And then testing other stress responses, inflammation markers, CRP, ESR, uric acid. There's so many different inflammatory markers that need to be tested as well to try to find root causes of why your body's inflamed. And then as maybe some of us know, inflammation is then what triggers a disease process.
Sure.
So stuff like that.
Yeah. I mean, at the end of the day, it's basically like what we're saying is, hey, here's all these major bullet points that the basic blood panel does assess for, but we need to be reading in between the lines, because in between each of those bullet points, there's a lot of sub bullet points that really clue us into what is actually driving what that number is, right? What's driving what that value is. If you're, and the thing I think that gets maybe misunderstood and brought up the most is like the cholesterol, like you mentioned, right? People are like, oh, my HDL and my LDL. Well, there's a little bit more to it than just that. And maybe we should unpack that just a little bit. Yeah. But well, why don't we do that real quick, and then we can keep going down this rabbit hole on like the heart health and how that plays into the athletic side of things. But most people, I still hear people talking about like good cholesterol, bad cholesterol, and what my triglycerides are. So when you assess somebody's blood and their lab values,
I didn't get that.
From a cholesterol standpoint, what are you looking for from a cholesterol standpoint in the blood?
Right. And yeah, forgive me, I forgot to mention, on the basic blood work, the cholesterol's usually assessed. And in your basic blood work, you have the total cholesterol, LDL, HDL, triglycerides. Again, important numbers, but very surface level and not the whole picture. So if you really want to look at cholesterol, what you need to do is you need to break it down into pieces. So to be quite honest, I don't really even look at total cholesterol anymore, because I equate total cholesterol to your body weight.
Mm-hmm.
You know, you could weigh 200 pounds and be all muscle or be all fat.
Sure.
It doesn't matter. 200 pounds is 200 pounds. Are you muscle or are you fat? That won't tell you. Just saying 200 pounds won't tell you that.
Yeah.
So same thing with total cholesterol. It could be a lot of good cholesterol. It could be a lot of bad cholesterol. It could be good. It could be bad. So again, that's a little bit of a misnomer. So I really honestly don't look at that much anymore. What you need to look at when you're really looking at cholesterol is size, shape, production, and transportation of cholesterol. So size. When it comes to cholesterol, we want big, fluffy cholesterol, not small and dense. The more small and dense a cholesterol is, the more damaging it is, the more it has a chance to go into the artery and start plaquing up, right? So the bigger and fluffier it is, the less chance it's going to actually bypass the
passes
artery
through, yeah,
and build up, right? Shape, production. Again, the more cholesterol you produce, and this is genetic by nature. I personally I'm a very high cholesterol producer by nature. The more you produce, in the liver is mainly where you produce cholesterol in every cell of your body, just FYI. You produce cholesterol in every cell of your body, but the liver is one of the main sources of cholesterol production. If you're a heavy cholesterol producer from your liver and other cells, again, the more cholesterol you have, the better chance of it plaquing up.
Sure.
And then you also have to look at how fast is it oxidizing? How fast is it hardening? Right? How fast is it hardening? And there's a marker on your blood called oxidized LDL that you can measure to see how fast you're hardening. Cholesterol needs to harden. It does. Cholesterol helps give you shape to your body and shape to your cells. So it needs to harden. Otherwise, you'd just be a big pile of mush. But if it hardens too fast, that's when lumps and bumps and plaques start to form.
Got it.
And then, the final piece of that is how is the cholesterol being transported to and from cells? And there's a marker called ApoB, which is a huge, important marker to measure, because that's honestly most recently been linked to heart attack and stroke most is high ApoB.
Got it. Got it. And that gets screened in the test that you're mentioning. Now, is somebody who might be listening to this, or, family member that we might go talk to, is that something that if they go to their physician's office, they can ask for, hey, we're doing this blood test, I want to know what my ApoB is. I want to know what this stuff looks like, if that's not something that's already in the basic sort of screening?
They can ask.
Yeah.
You can ask for anything. And any MD, DO, nurse practitioner, PA, anyone who has the ability to draw blood can order whatever you want them to.
Yeah.
They may make the argument of, well, insurance won't cover it.
Sure.
And then you have to make the decision, like, do you want to pay $20, which again, I don't know your financial situation, but I think $20 is worth getting an ApoB test done, and it's worth the money. But yeah, if insurance doesn't cover it, it may cost $10-20 to get it done, and just bite the bullet and do it.
Yeah.
You can order any test you want. The only argument they will have, a couple arguments they may have, is one, insurance might not cover it, and two, if they're honest with themselves, and I love a doctor who is honest, I don't know what to do with that information.
Sure. Yeah.
Right. I am not a cardiologist. I don't know what to do with it. I wasn't trained on how to. I can get you that. I don't know what to do with the information. So, but the bottom line is you can ask for any test you want. And this is my opinion. If your doctor's not willing to give you the tests you want within reason, go get a new doctor.
Sure. Yeah. And I would say the same things, if somebody was seeing me as a provider, if I'm not able to listen to them and take their thoughts and inputs into consideration within reason, right, then maybe they should seek out a new provider. Hopefully that doesn't happen in our office. But one thing that I do like, and I try to do a good job at this too, if I'm unsure of something, man, it is okay to say, I don't know, but let me try and help you either find the resource, the right person, or let me try and find out that information with you. If the provider doesn't know what to do with that information, don't pretend that you do, just say so, because the client typically is going to appreciate you and respect you more for doing that, and not just like making up some information. Okay, so say somebody is, interested in getting one of these panels done, right? They're an otherwise healthy person, but they've heard this podcast or seen other resources, and they're like, you know what, I need to go get that screening. I'm not necessarily feeling any issues, but I want to prevent one of these traumatic situations from happening. Do you have that conversation with people often? And then what does that sort of like, I don't know, trajectory or progression look like as we go down the line of, say that test comes back and it does show things that might be concerning, right? It's like, okay, we got this healthy apparent person, but we found things that maybe don't look so good on this test. Now what do we do?
Yeah, I mean, so bottom line, I'd recommend everyone do these type of tests, right? Healthy, unhealthy, whatever you got going on, I'd recommend people do these type of tests. It's better, in my opinion, it's better to look than not look. If it comes back great, then it comes back great. But if it does come back off, and I'll even take that back, even if it comes back great, something I would recommend. So if it comes back great, if it comes back off, I would recommend that people do this, that they look inside their arteries. Okay, so I have seen people with perfect cholesterol still plaquing in their arteries, still plaquing. And there's a lot of reasons why that can happen. Maybe, that may not be, we may not have time to discuss why, in this podcast, but you can still plaque even with perfect cholesterol, right? Due to other sources of inflammation and other problems you have going on in your body. And just a quick aside is, plaquing is your body's way of trying to fix itself. It's a healing mechanism. So a lot of people think, well, this stroke or this heart attack is my body working against me. Actually, it was trying to save you. It just overcorrected because the problem never stopped, and so the healing never stopped. So that's just something to be aware of. But so even if you have perfect cholesterol, you're still not out of the woods. You still should get your arteries looked at, and there's a lot of ways to look at someone's arteries, in the brain, in the heart, carotid arteries, all these different things. So personally, in my office, what we do is we do a couple different things. We do carotid ultrasounds. So I have twice a month, I have time where people come in and get carotid ultrasounds done. Now there's two types of carotid ultrasounds. There's regular carotid ultrasounds, and then there's something called CIMT ultrasounds. I recommend CIMT for what I'm doing. CIMT stands for carotid intermedial thickness ultrasounds, looking at the thickness of the artery, looking at the inflammation of the artery, and then looking at the plaque of the artery. The thicker and more inflamed the artery is, the more likely you are to develop plaque. And so we need to know this type of stuff. We need to know how much plaque you're dealing with, and there are ways to fix these things. So even if you have perfect cholesterol, and especially if you don't have good cholesterol, that's something I really recommend you do. 5 minutes, no radiation, great information. A couple other tests I'd really recommend is something called the calcium score, which is radiation based. It's a low level radiation. It's a high powered X-ray, low level CAT scan of your heart and your coronary arteries, looking for hard plaque. So there's a difference. There's soft plaque and hard plaque. This is looking for hard plaque by itself. And then the last one, and I'd say the most invasive, is something called a CT angiogram. I don't do a ton of those for a lot of reasons, but it's very effective, very good. I would not steer you away from doing that. But, a lot of people don't like dye injected into their bodies, and radiation and things like that. So it's a cost benefit analysis you need to have with your provider, or I'd have with you if you were talking to me. But it shows hard plaque, soft plaque within the coronary arteries. Probably the best test outside of literally going in with a camera through your femoral artery and snaking it into a coronary artery.
Yeah,
it's probably the next best to that.
Yeah, like you said, kind of this like cost versus benefit. Like, what's the invasiveness of the test? What are you actually able to deduce from this test? And, what's the one that you want to pick based on the situation? And it sounds like probably the two more common ones that you mentioned are the ultrasound of the carotid artery and the calcium score test are probably those two most common ones that get done, and that you recommend to people a lot. So say somebody who otherwise appears healthy goes and gets one of those tests. It comes back showing information that you would prefer it not show, right? It shows a little bit more plaque buildup or hardening or thickening than what you want. What are some of the next steps that then you would recommend to that person to, they feel fine at the moment, they're working out, they're exercising, they're in great shape, but there's things that you would recommend addressing.
Right. And just something quick to be said is the first symptom of heart attack is usually death.
Right.
Usually death.
That's a good point to make.
Right? Yeah. So when you say, oh, they're feeling fine now, well, yeah, I mean, it's generally, you hear about the chest pain in the left arm and maybe the nausea, the jaw pain or whatever. Most of the time people just drop dead. So don't rely on not feeling good to start looking at your heart.
Yes.
But if we find some stuff, so I mean, gosh, if whoever's listening to this, if you ever want to come talk to me and I'll show you my results. The first time I did my carotid ultrasound, it was horrible. I had inflammation, I had plaque buildup. I said, damn it, this is wow. I thought I had it all together and I thought I was doing great, but I wasn't for me. So what did I do? And this is what I recommend to my clients most of the time. I wasn't, mine wasn't terrible. It was kind of mid-range. It wasn't not that bad. It was kind of mid-range. So when I see a kind of a mid-range inflammation, plaque buildup in someone's carotid arteries or calcium score, I start with lifestyle and supplementation. Lifestyle being increased cardiovascular exercise, decrease sugar and carb consumption, because insulin plays a huge role in plaque formation and in cholesterol and triglycerides. And then I did some supplements and again, please talk to your doctor. I'm just going to tell you what I did. This is not a testament of what you should do. Please make sure you reach out to your medical provider, or if you want to, you can come talk to me about this and make sure this is right for you. But what I did is a combination of something called red yeast rice, bergamot, garlic, and coenzyme Q10, specifically ubiquinol, coenzyme Q10. And if you want to come see my results, they were tremendously improved.
We were just looking at those.
Yeah,
and they're definitely, and this was, if I remember the dates right, it was like what
7 months.
Yeah, like a 7-month period in between the two tests. Yeah.
So yeah, and sometimes that's enough for people, and that's all they need to do, and they just need to continue doing that until the plaque clears. Because what you could see on my carotid ultrasound was my inflammation was basically gone, and my plaque height had dropped by about 10%. So again, it's just a matter of being continuous about that. So that's kind of if you're intermediary. If you're severe though, if you have tons of plaque and it's very high or blocking the artery significantly, and you have a lot of inflammation, honestly, that's when I would go to medications. And what I have to remind people of, especially in this space, is medication is not the devil. Medication is not the devil, and medication is not a failure. Medication is a tool. I hope you don't need to be on medication the rest of your life, and that's the whole point of this: is catch it early, fix the problem, get off the medication, and then transition to supplements or transition to just lifestyle. Yep. Sometimes we are behind an 8 ball that we need medication, and the medications that I would recommend for someone who's really behind the 8 ball is a statin of some type, and I'm sure a lot of us might have heard of statins. But decreasing the production of cholesterol, specifically from the liver. So a statin, something called ezetimibe or Zetia, which helps block the absorption of cholesterol in the gut. And then the final thing I would recommend, again, depending on how far along and how progressed you are, is something called a PCSK9 inhibitor. The most famous one of those is Repatha, is what it's called. So those are kind of 3 medications, again, that I'd either take in combination or one at a time to help really decrease cholesterol in someone who's really behind it.
Yeah. So I think the moral of the story is you've got to do an assessment to even check these things, right? Otherwise you just don't know. And like you said, oftentimes people who end up suffering a heart attack, they don't have symptoms before that happens, right? They just have the heart attack, and there's a good chance they are not going to live through that. And so too often, I think someone who has a heart attack and does live through it, that's their wake up call, or that's their now warning. And now they get all these things checked, and then they start to change their lifestyle, and maybe they lose a bunch of weight or whatever that might be. But they didn't check those things before, right? And it maybe could have presented where they wouldn't have gotten to that point if they had, and then taken the steps like you just laid out, whether their lifestyle and supplementation to help address these things, or if necessary, use the medication for the tool that it is to help you try to rectify the situation. Yeah. So then now you guys, like we sort of mentioned a little while ago, are getting into some cool things here at Tri Vida in terms of like kind of doing a all-encompassing assessment for high-level athletes of, various age ranges. Tell me a little bit more about what you guys are doing there, and I guess, like, I don't know, what you're trying to accomplish with this program of, like, we're trying to improve the performance of people, and we're trying to make someone who may already be good great, or something like that, right?
Yeah, I can't tell you how many elite level athletes that I've known throughout my life that slept terribly, ate terribly, didn't take any supplements, and yet they were still just badasses, just unbelievable athletes. And I would sit there and tell them, God, if you would just let me look at your blood work, get you on some supplements, help you with your sleep, optimize your diet, you could be a world champion.
Yeah.
Right? I feel like your potential is being wasted at this level because of just your lifestyle choices and things like that. So, one thing we're really trying to do is optimize athletic performance through all avenues, nutrition being one of them. And there's a million diets out there. Which one's the right diet for you? It really depends. At least what I'm finding is on the science. How's your gut working? What's your microbiome look like? What are you digesting, absorbing nutrient wise? Things like that. So we're doing a lot of gut testing, nutrient testing to make sure you're getting enough protein, carbs, fats, but also micronutrients for optimization of mitochondrial function and body's ability. So that comes down to gut and nutrients, hormone balancing. And again, you have to be careful, especially if you're an elite level athlete, with doing certain hormone adjustments, making sure that whatever you're doing is legal in your type of sport. So I'm not necessarily just talking about putting people on hormones, but taking natural supplements or doing natural things to help improve hormonal function. Sleep is also another huge piece of health and wellness. I mean, and you're hearing that more and more in professional sports, how people have sleep coaches now.
Yeah.
And so I've partnered with a sleep coach that I've worked with personally, and that I'm working with now to help athletes again sleep better so that they can recover. If you're a fan of Andrew Huberman, which you should be, check him out on his podcast. He talks a ton about sleep and how important that is for mental and physical performance.
Yeah.
So if you're not sleeping well, again, I think you're leaving some stuff on the table. Also, working with physio room and making sure that your body alignment and injuries are all optimized as much as possible, and muscle tone and muscle activation and all these other things are working as much as possible. So that's really what we're doing. And then also in regards to heart health, doing echocardiograms to make sure that these sudden deaths that happen on the field are caught before they happen. And one of the most common reasons these sudden deaths happen is usually caused by something called hypertrophic cardiomyopathy, or an enlarged heart, that unfortunately it's really hard to hear with a stethoscope, or really hard to find outside of doing an echocardiogram. So we're going to start doing echoes on all of our athletes to make sure that stuff doesn't get missed. It is rare. I'm using air quotes here, rare, but it sucks if you're that one.
Yeah,
and it sucks for your family.
Right. Yeah, it's rare, but it happens, right? It's it's something that with good screening, we can we can try to mitigate these risks as best that we can. And you're absolutely right on the all the stuff that you said, particularly the sleep performance, there's so much more information out there now about how important sleep is and how getting the proper rest can improve our performance. That wasn't even something that was talked about when when I was a kid playing sports. And I mean, it was mentioned like, oh, try to get a good night's sleep before, the day before your event or whatever. But if that was pretty much it, that was like the information. There wasn't like the science behind it that we have now. Fast forwarding, half of my life later. But I think high school athletes especially are one of those groups of people that maybe aside from adult athletes that have kids and have jobs and whatnot, like high school athletes are really busy. They're going to school. Many of them are working. Many of them are in other clubs and activities outside of the sports that they're playing. In the sport might be part of school. It might be outside of school, right? They might play soccer for the school and soccer for a club or something like that. And their schedules are very daunting a lot of times. And I think some of the people that I've seen in the office or that our providers have seen in the office who have like the most restrictive schedules are those high school athletes, right? More than anyone else.
Right. Absolutely. Yeah. And so it's also something we're really trying to work on is building it into their life, not throwing in another thing that they have to do
right
in an already crazy schedule.
Yeah.
Right? So trying to make it as easy as possible.
Yeah. And sometimes, like you said, like you've worked with a sleep coach, sometimes that's just what you need. You need that coach or that guide to like help you just kind of tweak things, right? Not necessarily give you a bunch more things to do, but how can we make this one minor adjustment, this other moderate adjustment, and see those changes rather than additions really spark the benefits or the changes that you're feeling. Right. And then, the performance potential, I think, that comes out of this it's hard to measure because we don't know what the end result is. But yeah, I'm with you on that. There are a lot of really high level athletes out there that they might not be taking care of their body from like a nutrition and a sleep and whatnot standpoint anywhere close to what we would consider optimal, and they're still performing at a high level. Just imagine what what it could look like.
And I worked in professional sports, and none of this. I mean, this was, albeit 15 years ago, but I saw none of this. Like we'd eat pizza after the game, and the nutrition was abysmal, right? And yes, there was massage therapists and acupuncturists. There's no dietitian. There's no sleep coach,
right?
We weren't, sports physicals even at the professional level were very minimal. No echocardiograms.
Yeah.
So this is like I hope that this can translate into even professional, university level and professional sports.
Yeah, totally. Yeah. And I think I did an episode on this, maybe a year ago about like sports recovery and all these different tools and modalities we have, massage and ice baths and heat and all this stuff. Well, you can't sports recovery, in air quotes, your way out of a poor lifestyle, right? Like that stuff is the foundation. And then the sports recovery things that you can layer in on top of that help you with like that tip of the iceberg or the peak of the mountain, so to speak. But you can't massage your way out of not taking care of yourself, out of sleeping 4 hours a night or whatever. It's impossible, right? Though there's a huge time and a place for those things, and they can be very beneficial, but they're even more beneficial if you lay a really good foundation through all the other things, the sleep, the nutrition, the whatnot. So yeah, I mean, I think the program you guys are putting together is awesome. And I think, for those people that, whether it's here or anywhere else, start to focus on these things, this usually will drive the other things, right? Like what your performance is dictated by how you prepare and how you take care of yourself. So what else did we miss, Corey? We talked a little bit about heart health, kind of the importance and the need for regular screening so that you can clue yourself and your provider can get clued into what's going on under the hood, basically, right? When all else appears well. And then I think, we started to talk about kind of from an athletic standpoint, how you can fine tune things. And I kind of want to use the analogy of like, this kind of makes me think of like most of us, quote unquote, normal people's car that we drive around, right? Though it's basically the same thing, it's very different than a race car, right? A Formula One car or a NASCAR. Those things get fine-tuned, even if there doesn't appear to be a problem, right? The mechanics are trying to optimize that for as peak of performance as possible. And at the end of the day, it's still a car, right? And it could get you from point A to B, but will it be able to perform at its maximum potential?
Right. Absolutely. So, I mean, gosh, one other thing I would just off the top of my head that I think we missed was another blood test that I think everyone should get is something called LP(a). That's another test that I think everyone should get. That's the kind of genetic predisposition of how heavy a cholesterol producer you are, but even by itself is a very dangerous cholesterol marker. But yeah, I mean, if you could create a kind of a checklist in your mind of all the different things that you can do to optimize your vehicle in your body,
right.
That would be ideal. And again, unless you're trained in this type of stuff, this can seem very daunting. But let me just give you my checklist real quick to make sure that you're not missing anything. And this is in no particular order, but gut, gastrointestinal system, which includes the microbiome, micronutrients, food allergies, food intolerances, hormone balancing, stress reduction. And when I say stress, I'm talking about 3 types of stress: chemical, physical, emotional. Right. So emotional stress, that's another big one, especially when you're talking about sleep and performance. I think any athlete knows that if they go on the field or court or whatever with a lot on their mind, they're not going to do very well.
Right.
Right. So, emptying the brain, meditation, these are all things that I think are hugely important, hugely missed. I mean, all of us make time to go to the gym or run or do physical activity. How many of us are actually making time, and I'm talking to myself included, sit down for 10 minutes and empty our brain?
I'm glad you said you're talking to yourself included, because I felt like you were talking to me. And that's been an area that I'm trying to improve for myself. So yeah, I'm glad you mentioned that.
It's not the American way. American way is go, 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 do, achieve. I think that's up, and then that can cause heart problems, and that can cause physiological breakdown.
Sure.
Like that. So, stress management, chemical, physical, emotional. Make sure your body's detoxifying appropriately, and I'm not talking about sticking the hose up your rear end or doing any type of hardcore fasting, which has its place for some people, or juice cleanses or anything like that. I'm talking about getting your body the right nutrients, fixing your gut, fixing your hormones. This is how your body detoxifies. And then exercise. When you do exercise, make sure you're exercising not only for your goals, but for your body type, for your body composition, for your hormones, for your sleep. Again, if you're not sleeping well, not eating well, your hormones are drastically out of balance, the last thing you want to do really is push yourself too hard, because that will then perpetuate all these problems we're talking about. Yeah.
No, I think that 5-point list is hugely important, and a lot of times we need a coach or a guide to help us figure out where those things are and what little pieces can we put into place to kind of optimize those things. So I want to make sure we include this all in the show notes. This will be in there for you guys to click on. But Corey, how can somebody get in touch with you guys if Tri Vida is a place that they want to check out, or they have questions? I'll say this, I always end these podcast episodes and interviews with, as soon as we hit the stop button, it's like, oh shoot, we forgot to talk about this, or we forgot to ask that question. So those things are definitely going to happen if this episode brings up questions for people. How can they get in touch with you guys to maybe ask those?
Yeah, I mean, so you can always give our office a call at 720-428-8312, or go on to our website and book a discovery call. And all a discovery call is, it's 15 to 30 minutes, free of charge, and just want to get to know you, see what's going on, and see if we can help. And we'll be the first to tell you if we can't help, and we'll get you into the right place. But if we can help, and that's something, and if it's, if what we're saying makes sense to you, then we go into an actual visit with myself, where we sit down for like an hour and a half, and really dissect what's going on, and most importantly, build a plan moving forward. So what I tell people is, if you sit down with me for an hour and a half, whether we work together or not, you will come out with a plan. Whether I help you with the plan, or someone else helps you with the plan, or you do it yourself, that's up to you. But yeah, if you want to sit down and build a plan with me, that's how we kind of get to it.
Mm-hmm. Yeah. And we'll also include here in the show notes, obviously the website, the phone, and any other ways on the internet that you want to get in touch with Tri Vida, you guys. So again, for all of you that tuned in to listen to this episode, Corey, thank you for joining me. I hope you guys found some valuable information here on this episode of The Code, and we'll catch you guys next time. Thank you so much.
Thank you.